So let's solve the most recent challenging case. I have shown you most of the viewers correctly diagnosed it as a case of tobacco dusting, also known as Schaeffer's sign. Few of the viewers they were saying vitreous in the anterior chamber. Well, actually they are also not wrong, because when I magnified the view, it looked like the pigmented cells they are present in the anterior chamber. So they also were not, because when such pigmented material is present in the anterior chamber, the vitreous looks exactly like this. So what can you see here? Yellowish brown pigmented cells in the anterior vitreous, and it should always raise your eyebrows, because it can indicate a serious condition, an acute posterior vitreous detachment with a retinal break or rhegmatogenous retinal detachment. And if picked early, you can save the patient's eyesight. Now another question arises, that from where these brown cells arrive into the anterior vitreous. Well, when the retinal break occurs, it gives way to the pigment to be released from the retinal pigment epithelial RPE cells of the outer retina, and these cells come into the anterior vitreous. Such patients will also give you other clues, like they will present with complaints of flashes due to vitreous traction, specifically induced by eye movements and floaters, and curtain-like loss of vision in a specific quadrant. So these symptoms are decrease of vision, tobacco dusting, finding of acute PVD retinal break will lead you to the diagnosis. If it's just a fresh break, you can prevent retinal detachment, and you can find a full-blown rhegmatogenous retinal detachment, like in this case with grade C PVR. We'll discuss the case later on in the next video. Now DD, differential diagnosis of the Schaeffer's sign. We have white cells which are inflammatory, white blood cells present in vitritis in different uveitis. Red cells indicates vitreous hemorrhage. Glistening white large round bodies indicate asteroid hyalosis. So Schaeffer's sign is a quick, reliable method to diagnose retinal breaks. Thank you very much.